The COVID-19 pandemic presented numerous challenges for the UK. Would we have enough intensive care beds, ventilators and PPE? Could vulnerable people access goods and services safely? And now, can we rebuild our economy without generating another critical rise in infections? But what if intensive care treatment is always scarce, and leaving your home every day is necessary to access water and food? Dr. Chris Moxon describes the impact of the COVID-19 pandemic on people living in Malawi and the particular challenges they face.
Well, beautiful and home to some of the world's friendliest people, Malawi is also one of the world's poorest and least developed countries. So COVID-19 has the potential here to have very severe consequences. The focus has had to be in trying to slow the speed of transmission and to maintaining infrastructure for basic medical care. One of the greatest risks we have here is that COVID is going to increase death and disabilities from major killers such as malaria, TB, HIV and diarrheal disease, because the pandemic may break down the infrastructures that have enabled us to decrease these over many years. While it's good to see that the government has responded to the recent rise in cases, trying to limit transmission in this very low resource setting puts a lot of strain on the population, and many of the measures that have been taken in other places are very hard to implement here. Crowding at communal facilities such as boreholes, marketplaces and on minibuses is a real risk for spread here. Very difficult to control and only offset a little bit by a population that's mainly rural. Some of the larger commercial stores, even some small shops, have made efforts to enable hand washing using buckets with taps on them or employees at the gate with hand sanitizer. But these are still communal facilities and aren't available everywhere. Most people wouldn't be able to eat in a lockdown situation. They live off informal work, subsistence farming, and they don't have savings or reserves that they can fall back on. Malawians can't afford to stock pantries, they don't have fridges, and most people need to go out and collect water. Many people's livelihoods depend on small-scale, informal sector movement of goods within Malawi, and also across the borders with Tanzania, Zambia, Mozambique. So, although flights were stopped early in the response to the pandemic, there are many other boarding crossings which are very hard to control and have probably been responsible for transmission of COVID into Malawi. Now, with cases significantly increasing, most transmission is from within the Malawian community. One of the main ways to get around here is by minibus, and minibus prices have gone up substantially during the pandemic and has become unaffordable for many people. A social distancing law meant that you had to have only one person for every 2 seats, and that's basically caused the price of journeys to go up by double. Cost, but also availability, has also hampered us trying to roll out mask wearing. It's become a requirement to wear masks in public indoor spaces such as shops, and most people are actually keen to wear them, but commercial masks, which cost about $1 each, represent a day's wages for most people. Many NGOs have helped with this, and charities and small businesses are making fabric masks. Weddings, funerals and church services are also a major source of transmission, and Malawians are in general very religious, so this is a hard thing to reduce. Some churches and mosques have made efforts to induce social distancing by holding smaller services with less people at increased frequency, or are using sanitation or outside spaces. Recently, political gatherings around the election were a significant transmission risk too. Shortage of mental health provision is a major issue here. There isn't sufficient funding for this in normal times, and certainly no capacity increase for the number of increased issues from isolation, increased domestic violence during the pandemic. The provision of PPE is a critical issue and a major concern. PPE prices have been driven up around the world. Luckily, in Malawi, many charities have stepped up and made notable efforts to help. In the paediatric department where I work, we were blown away by people's generosity, in particular through our own charity, Friends of Sick Children. Charities have also been donating masks for us to hand out to people. World Health Organization, Wellcome Trust, Red Cross, St John's Ambulance and local charities including Road to Relief have all provided really important support for PPE, and we really hope this generosity and energy lasts as cases continue to rise.